Good morning, ladies and gentlemen. In this video, we're going to be covering psych nursing interview questions and answers. I already did another video about the mindset you should have walking into the interview, how to prepare yourself for the interview, stuff like that. In this video, all we're going to do is just go through a bunch of sample psych nursing interview questions, and I'm going to answer them. Now, one warning here, that doesn't mean the way I answer them is the way that you should answer them, because everybody's answer probably depends a little bit on their own experience. Plus, just because I answer it that way doesn't mean it's necessarily the right answer. I'm just giving you this video so you sort of have a framework with how you might want to answer an interview question. But again, because I answer it a particular way, doesn't mean it's necessarily the best answer. It's just the way that I would answer the question. All right. By the way, I forgot to mention in this video, everything is time stamped. You can fast forward, rewind, whatever. And if you're liking this video, don't forget to hit that subscribe button and give me a thumbs up, all right? Tell me how you stay motivated in a sometimes stressful career. And I think to answer that, I would just say, you know what? I'm gonna talk with my coworkers at my job sometimes. We're gonna talk about our stresses. We're gonna share our experiences. At the same time, I also realize, look, the clientele we work with, these people are going through some of the hardest situations in their life. And if I was in their shoes, I'd want someone who cared and someone who showed respect. And that, as a nurse, kind of motivates me. I know at the end of the day, maybe there's not a huge change in our patients' behavior. Maybe it doesn't seem like we're doing that much. But I feel like if we treat them as people, at least they're getting that much. And that makes me feel motivated. It makes me kind of feel nice. And that's how I stay motivated. How do you handle a patient when there are concerns about your own safety? If I'm concerned about my own safety, I know I'm not going to give the best patient care. Plus, I might be a little anxious, and I don't want that anxiety to come off when I'm interacting with a patient. So if I truly feel like I'm going to be unsafe in a situation, then I'm going to ask myself, okay, what do I need to do to feel a little bit safer? And the reality is you're not always going to feel 100% safe. That's just kind of the nature of psych. But there are things you can do to feel safer. So I'm going to ask myself, what do I need to do to feel safer? Which probably means bring more people with me, make sure I have my panic alarm. If we have security, bring security with us. Have some medication I can offer the patient if we're going to interact to help calm them down. And I think after I ask myself, what do I need to do to keep myself safe in this position, and I answer those questions, then I'm going to ensure my own safety. And it also means, like, in the back of my mind as a psych nurse, I always am thinking about, especially with a patient who I feel like could be potentially dangerous. I'm like, okay, what's the worst that could happen, and how am I going to handle this situation? Which maybe even means me thinking about, okay, if this patient comes after me, where's my exit? How am I standing? Stuff like that. So that's what I do to ensure my own safety. How do you practice self-care when I'm not at work? I tend to try not to think about work. Doesn't always happen, but usually it works. And then just have a bunch of hobbies that I enjoy. Basketball, working out, reading books, stuff like that. So that's how I practice self-care. And then just sometimes, honestly, after a hard day of work, I will literally just come home, I'll wrestle with my kids, get them in bed, and then I will just sit there, like literally sit there and do nothing, stare at a wall. I feel better after doing that. How do your organizational skills influence your position? How do your organizational skills influence your position? I'm kind of a literal person. I might ask them to clarify this question. I think what they're trying to get at is, how does staying organized influence what you're doing on the job? I don't know. But I would say at the current job I'm working at with this private inpatient hospital, we do a lot of paperwork. It's kind of half electronic charting, half paperwork. So you have to be very organized. And I just kind of set things up in a very incremental and very chronological way when I'm doing, say, an admission or a discharge. And when I'm done with this here, then I know I need to move on to this here. And so I would say that times when I've been unorganized, because I felt like there's been so much going on the unit, that I haven't been able to set my stuff up the way that I want to set up. I mean, then you feel overwhelmed because, like, crap, I did this, I forgot to do this. And so, yeah, that's how organization influences my day. What made you want to work in the mental health industry? I just really enjoy people. I enjoy one-on-one conversations. I think mental health is just fascinating. I find schizophrenia to be fascinating. I feel like people who are diagnosed with schizophrenia, they almost have this ability to tap into another world that none of us neurotypicals will ever be able to understand completely. And so that kind of fascinates me. It always piques my curiosity. And that's how I got. In fact, a long time ago, before I became a nurse, I wanted to be a psychologist, but I was like, where am I going to find a psychology job? And where am I going to find one that pays a decent amount? And I couldn't really answer those questions, and so I became a nurse. How important is teamwork to you? I'm going to take a sip. You should take a sip. In an interview, if you need some water, you pause and you drink some bizarre tea that I don't even know what this is. Although it's actually pretty good. How important is teamwork to you? It's extraordinarily important to me. I mean, without your team, you potentially jeopardize your own safety. The reality of sometimes psych gets to be extremely dangerous. And I've definitely had a few times when it's been a little nerve-wracking working in psych, and I'll say having a team is awesome. Knowing that you can press a button, at least when I worked at the state hospital, I could press a button on my hip and I'd have a plethora of people come up and support me. It makes you feel a lot safer, and when you feel safer, you don't feel as anxious. When you don't feel as anxious, you're giving better patient care because you're in a calmer state of mind and you're able to handle stress better. So teamwork is very essential to me. How do you handle longer than average work shifts? I get a little frustrated, to be honest. I got a family. I got 2 boys who love to see me when I come home. So although I'll do them, it's certainly not my preference to work more than 12 hours, and I am expecting at this point in my career that it doesn't happen that frequently. I understand, of course, there are some things, unforeseen things that happen. Sometimes we have to stay a little longer. I get it. At the same time, I appreciate being able to come home to my family at the same time every day. What would you consider to be the most difficult part of this career? What would I consider to be the most difficult part of this career? I would say probably sometimes it's difficult as a team to decide what exactly is the best for a patient, because you could have five different people. I guess if you say 5 people, it already includes the word different. But if you have 5 people and you all kind of think just a little bit differently on how the situation should be handled, that can sometimes be a little difficult, because it's really important that everyone's on the same page. So I think for me, that's probably the most difficult part, is figuring out, okay, how do we include sort of everyone's opinion and come up with a single course of action that's going to be best for this patient. I think sometimes that can be very difficult. Tell me how you gather important details during intake. Well, what's nice about this current position I'm in now, where we do admissions and discharges, and you pretty much do everything as the nurse, is we have a whole little cheat sheet. So when they come in and I'm doing my intake, and I go through this entire sheet, it kind of already, as long as I follow it, it does a pretty good job of not missing any important details, assuming that the person is willing to answer the questions. And I'd say probably about 50% of the time, you get someone who's just in such a traumatic state, or they're so psychotic that it's kind of difficult to do the intake. So at that point, I give them a breather. They kind of need to acclimate to the unit, and then we'll revisit the questions. And then I just ask a lot of open-ended questions during intake. Let's say I ask them, in our intake, we have one in there for insomnia. So I'll just ask them, tell me what your sleep is like lately. How many hours? How's the quality? What do you think about if you wake up in the middle of the night? Things like that. So just lots of open-ended questions during intake, and that's how I gather important details. How do you respond to feedback from supervisors? Sorry, these questions are just, I don't know. They're just so general. I always say in an interview, my response is going to be equally as general as your question is, because that's the reality. So how do you respond to feedback from a supervisor? Great, assuming that they give feedback in a professional manner. I don't know. How do you respond to feedback from supervisors? As long as the feedback is useful, it's helpful, it's objective, I have no issues. All right, you guys, we're hammering through these questions. If you're enjoying this video, please give it that little thumbs up and subscribe. It's 1 a.m. A patient is crying hard, and other people in the ward cannot sleep. The pressure is escalating, and you happen to be the only nurse on shift. What do you do? It really depends on what our options are. If they're crying really bad and other people cannot sleep, it's not fair to those other people. So I might try to see if we could move this patient somewhere to where they can still cry and the rest of the ward can't sleep. So hopefully if they're up crying, then obviously they're awake. So probably take them to maybe an isolated room where we can shut the door. They can cry, they can vent, someone can talk to them. And then hopefully the other people will sleep. Maybe ask them if they need a PRN. Just kind of console them as much as possible. Actively listen, all that good stuff. And then hopefully everything's kosher. Probably just play it by ear from there. A patient refuses, oh man, whoever wrote this, English was not their first language. A patient refuses his dosage of drugs repeatedly. What would you do? But the question's there. Like, what would you do if a patient just continually refused their medication? I usually just ask them what prevents them from taking the medication, then I play it by ear from there. And if they have concerns about side effects or whatever, we discuss those concerns. What would change your mind about taking this medication? If this wasn't a side effect, how would you feel about taking the medication? Stuff like that. Give me an example of a time when you had to interact with a patient who was in great mental distress. Great mental distress. All right, recently I had a gal who wanted to be discharged from our hospital. She was put on an M1 hold, so she had to be up there up to 72 hours. It was a holiday weekend. The place I work at doesn't count holidays and weekends, so this meant she was going to be there longer than expected. The prior day, she had presented as somewhat psychotic and confused. The following day, she was all of a sudden lucid, upset, angry, agitated, and she wanted to leave. So really I just had her vent, and I came out there, and I truly felt and I agreed with what she was saying. She wanted to get out of here. She didn't feel like this was the best place for her. She just wanted to go and do drugs. The reality is she's a chronic meth and heroin user. She wasn't getting meth and heroin in the hospital, so she was, I don't want to say withdrawing, but she was certainly feeling the effects in her body from not having those drugs. I almost said medication. But the reality is she probably needed them. She wanted a cigarette. She was really pissed off. She was no longer gravely disabled. So all I did is I just validated her concerns. In fact, I told her I agreed with her. And at the same time, I was legally responsible to keep her there because she was on an M1 hold. She refused adamantly to do anything. She even became, initially she was kind of aggressive, was posturing a little bit, and because of all those things, eventually just agreed to discharge her to a higher level of care. And I told her, I was like, look, here's the reality. We can send you to another hospital, but it's going to mean that we're going to transfer our M1 from us to them. I have no idea how they're going to handle the M1. They may keep you there longer. They may discharge you today. She was like, that's fine. She said she understood. She just wanted to see her son. She wanted to get out of it. So that's what we did. Ultimately, before we put the M1 on her, she was voluntary. And I'd already talked to the provider about her because a few days prior to this incident, she had said she kind of wanted to go. And the provider was like, you know what, if she really wants to leave, she's voluntary. It's up to her. It's against medical advice. So it's not as though I was making this decision per se without our provider's knowledge, but I knew that we could discharge her AMA. We just had to get rid of the M1. But the only solution in this problem was to really send her to another hospital who had someone who could terminate the M1 because we did not have the clinical staff to terminate an M1 until I think about 2 days, which is a learning lesson for me, because I didn't realize someone could put an M1 hold, but they also could not discontinue that hold. I was just flabbergasted. We have clinicians that can start an M1, but they cannot terminate them. And our licensed psychologist can terminate them, but she wasn't going to be there for 2 days. So hopefully that answers the question. I went on a little bit of a tangent, but essentially I just validated her concerns, and I truly, honestly was empathizing with her. I really felt bad for the lady, and I feel like when she picked up on that, she calmed down. Ooh, I like this one. There are 2 boys on the unit, physically and verbally fighting over a toy they want to play with. One of them has autism. What would you do? Well, in my limited experience with adolescents and with boys and raising 2 boys and all of that, I'm going to think, someone who's autistic, it might be difficult to give them an explanation that's rational to us. And this doesn't say how old the boys are. So I'm assuming one of the boys can kind of understand reason a little bit. So I'm probably just going to say, look, this is his toy for now. Can I come? And when I say this boy, it's the autistic boys. I'm just going to say, look, we'll name them Marcus and Mike. Mike is the autistic one. I'm going to walk up to Marcus and say, Marcus, look, right now Mike's going to play with the toy. Come and talk to me real quick. And then I'm going to explain a little bit that some people developmentally are not at the same place that Marcus is at, and that it's important for him to kind of understand that and to respect where someone else is at developmentally, which means when they want to use a toy, we just give it to them and we're going to find something else to play with. And I'm going to help Marcus find whatever it is that he wants to play with. It's one of those things that he just wants it probably because Mike has it. And I think that's how I'm going to diffuse the situation. Just because I feel like people with autism just can be very unpredictably explosive sometimes. And so I think I would just cater to what his diagnosis is, and that's how I'd handle that situation. Please explain about a time you were under a lot of pressure. What was going on and how did you get through it? I would say just anytime that happens at work, I usually take a brief moment to step back, because oftentimes we'll feel like we're under a lot of pressure or stress. And you step back and you just look around. It's like, well, there's nothing really happening. So there is an internal component to it. I mean, we kind of stress ourselves out as much as we want to. And most of the time at work, stress is not even real. It's not as though there's something urgent, like the world is about to, I don't know, cave in or something. It's just that we feel pressure because we've got maybe so many tasks to do. So you just step back, and that's what I do. I step back. I'm like, look, I just need to separate myself from the situation real quick. And then I just think about, okay, what is the big important stuff that I know has to get done or that needs to be addressed? And then I tackle that stuff and I worry about the details later. And that to me usually helps with stress. And then when I take a step back, just realizing, look, like this is life. You're here. It's okay. Everything's going to be fine. Just breathe. And sometimes taking one or two good abdominal breaths really helps when I'm under a lot of pressure. Tell me an example of an awkward situation at work. How did you remove yourself from the situation? Awkward situation? I mean, I don't know. There's so many awkward, I don't know. Psych is filled with just awkward situations. You'll be having conversations that are completely awkward with patients. I don't really remove myself from the situation unless I feel like I need to. I mean, sometimes you'll get patients who will awkwardly talk to you endlessly, stream of conscious. And then I just say, sometimes I'll just tell them straight up, like, look, my cup is full and I know you have more to say. I still need to digest what you've told me already, so I'm gonna step away for a while. Or I'll just, sometimes with patients, you just walk away. I'll just walk away. I don't do it like with any body language. I just neutrally walk away. I don't know if that answers the question. I feel like this question's awkward. That's what I would say in the interview. Give us an example of an important goal you set for yourself. Did you accomplish that goal? How did you ensure that you accomplished it? Ooh. All right, I have small goals throughout the day when I wake up, which includes making my 4-year-old's smoothie. And my goal in the morning is to make it. I just have to make it before I leave to work. So I pretty much allow myself to do whatever I want to do before a specific time. And then when that time hits, which is usually around 6 o'clock in the morning, then I know I got to go and make the smoothie. What's the next step? Did I accomplish that goal? Yeah, so I just make it a priority. So every time I wake up, I just remind myself, hey, I got to do it. And then I do it. And then how do I know that I do it? Because I see a completed smoothie at the end of when I'm done making the smoothie. And he generally likes it. So did that answer the question? That might have been a silly example, but yeah, that's how I'm going to answer it. Tell us a time when you received negative feedback and turned it into something positive. All right, I get where this question is going. I don't really feel, though, that I've received negative feedback before. I'm trying to think if I've received negative feedback. My one boss and I would disagree sometimes on this particular state unit, and she and I would just talk about it. And when I disagreed with it, I'd give her my concerns. She'd give me mine. There was one time we had to agree to disagree, and I told her straight up. I was like, Kim, I don't agree with what you're saying, but I'm going to do it because I appreciate you. And that was true. I was being honest. She and I would not always see eye to eye when it came to patient care. I feel like she could be sometimes a little too abrasive, a little too just by the book about every single patient interaction, and I'm much more fluid. And she and I would just have these open dialogue conversations about it. At the end of the day, she was my boss, she was my superior, so I had to do what she had to say, or I had to do what she was telling me to do. And I can't remember anything specific off the top of my head, but she and I would just have an open communication about it. And I'm totally fine with that, because you're not always going to see eye to eye with your supervisor or with people you're supervising. And I feel like as long as you can have an open discussion about it and you both can kind of hear everybody's concerns and opinions about something, and then you can kind of come to some sort of course of action after this dialogue. I'm butchering this question, by the way. Sometimes you just butcher questions. You just absolutely butcher them because your mind is just rambling and it's early in the morning. You feel like you're about to fall asleep. And then you just make an excuse like that. I just butchered that question, you guys. It's okay to butcher a question. You're going to butcher them. I've butchered many questions. And I would just be like, all right, I butchered that question a little bit. Hopefully I answered it. I don't even know. Did I answer that question? Do you have any follow-up questions? That's what I would say at this point. Tell us an example of a mistake you've made. How did you handle it? All right, I'll tell you about my first medication error ever. It was when I was a brand new nurse. Happened probably within the first 6 months. I don't remember exactly when, but I gave somebody double the amount of Depakote, of that valproic acid, that thick, syrupy liquid that we love to give our patients. I gave them double that dose. And how did I do it? I think I misread the MAR. Maybe it was some sort of titration. So then my joke was, luckily I had really good rapport with the patient. I was like, look, bro, I messed up. I just gave you a loading dose, and I told him what a loading dose was, jokingly, of course, because that's not even what the order was written for. But I said, I think it was like double. I just gave you double the amount. I don't think it's going to be a big deal. But so I called the provider. We had an on-call doc at the time. And I don't even think he was a psych doc, but he researched it. He's like, oh, it turns out with this Depakote, you'd have to give someone basically the entire bottle before you're going to jack up their liver, assuming that they have a healthy, functioning liver. Luckily for me and for the patient, he was young. His liver was fine. He was chill. I felt like an idiot. I apologized. And that's how I handled it. There was no adverse effects, of course. And I'm lucky because he was chill. Some patients, I think, could have gotten, rightly so, very pissed. But I lucked out. Explain to me a situation when you had to work closely with a difficult coworker. How did you handle the situation? Were you able to build a relationship with this person? All right, I'll give you one specific instance where I worked with this charge nurse, and I was floating to this unit. And when I was on the unit, there was this very, very minor assault. I was on a 1-to-1. I witnessed the assault. Because I was on the 1-to-1, I didn't have a chance to chart it at that time. And it was very busy. This was an admission unit. I mean, it was, and that day was pretty heated. We had lots of patients who were getting aggravated, et cetera, a lot of de-escalation. So when the shift finally calmed down around 5 o'clock, maybe 4 o'clock, I don't remember the specific time, I charted the minor assault that I had witnessed on the floor. Well, this charge nurse pulls me aside, but prior to this, she and I had more or less a decent relationship. I think this was the first time I had worked with her. She didn't really say much, but she told me kind of what her expectations were throughout the day. This is what I'd like you to do. We did it, etc. And then later, she comes up to me and she's very, what appears mad. She's like, I need to talk to you in the back office. And I'm like, okay. So she and I go back there. There's another staff present. She takes her glasses off, and then she asks me why I charted this assault and why I charted it so late. And I explained to her that I was on a 1-to-1. I didn't have a chance to chart it. And she said no one else had charted it. And I was like, well, other people were there to witness it. So someone else could have charted it. And what had happened is like one female patient went up to another patient and she literally went like this. But it's still, I mean, it's an act of aggression. I feel like something like that still needs to be charted. So I charted it. Well, she got really pissed at me. Like really pissed, saying that this person was not the person I was, what did she use? That I was assigned to chart. So I told her, I said, look, I understand you didn't assign this person for me to chart on. At the same time, I'm a nurse on the floor. I can chart on anybody who I want to chart on. And if I need to chart on them, I'm going to chart on them. And so she and I kind of go back and forth. I mean, she's pissed and she's irate. And she got to the point where she was, I can't remember what she said, but she was insulting. And I think most people would have felt like at that point it was a pretty hostile work environment. So I had to tell her that the conversation needed to remain professional or the conversation was over. She didn't remain professional, so I told her, okay, this conversation is over. I walked out the unit. Then I called our staffing at the time, and I told them that I wanted to be removed from the unit because I didn't feel safe working with her. I mean, she came out, and then she berated me in front of patients, like, I never want to work with this guy again. What else did she say? I think she called me incompetent because I charted late. I mean, all these accusations that were very unprofessional. And then later, so I don't know what happened. So later she and I worked again. This was months down the road. And a lot of people were telling me that she had some personal stuff in her life, yada, yada, yada. I mean, to me, quite frankly, I don't care what's going on in your personal life. You have to be professional at work. But I feel like after that, we kind of still had a relationship. Because we definitely worked again. There was no hard feelings. I mean, the reality is, and I think I even told her, like, it's kind of spilled milk. Like, I'm not someone who really holds on to anything. You can be unprofessional with me. I might get a little frustrated, but I'm not going to hold on to it. And I just feel like you have to remind yourself that we're there for the patients, not for interpersonal conflict, not for drama, not for gossiping. And if you have issue with someone, it needs to be handled in a professional manner. And the way she handled it was, from my perspective, completely unacceptable. I don't tolerate that kind of verbal abuse while I'm working. And I feel frustrated when that kind of thing happens. And then I know that I'm not providing the best patient care. So that's how I handled it. And then I think I remember talking to HR about the situation, and yeah, that's how I handled that situation. Explain to me a time when you were faced with a patient who chose not to communicate or disclose important information. How did you handle the situation, and what was the outcome? I mean, this happens all the time, especially in psychiatric care, not because the patient necessarily willingly withholds information, but they might just be too acutely psychotic, to have a question with you, or even if they understand, to understand your question. And even if they do understand your question, they might be so psychotic they might not be able to give an answer that we can understand. I think this comes often about when you ask a patient when their last bowel movement was, and they may not even understand what you're saying. And so something like that, you just monitor it. Or even with pain, for instance. So let's just say someone's not able to communicate when their last bowel movement was. Then as a team, we might be like, look, we don't know when this guy's last bowel movement was. Can we keep an eye on the bathroom, or just kind of keep an eye on him and see when he goes? And then we can try to figure out if he's had a bowel movement. Another thing is, like with patients who are sometimes in pain, but they can't really communicate it, then you just sort of do a head-to-toe assessment. You try to figure out, are they complaining about anything weird? We had one guy, he's chewing food, for instance. And then I just happened to notice, like, when he chewed food, he only chewed it on one side of his mouth. I'm like, well, maybe there's something going on the other side. And then you look, and there's this big abscess up there. Then when he finally took oral antibiotics, his aggressive behavior, imagine that, right? Imagine you're out of pain, you don't feel aggressive anymore. So it's just kind of stuff like that. You just kind of monitor it and try to figure out ways to understand it. And sometimes you just miss it. Another patient we had, he couldn't communicate it, and sometimes he had a history of being very gamey. And one time I eventually went in with a pen light, and when I was doing his neuro check, because we all thought, I kind of thought a little bit he was just sort of gaminess. But then when I went to do his neuro check and I used the light on his eyes, and I saw that both of his pupils, neither one of them really responded adequately, then I knew, okay, at this point it's severe, something's going on. Later, this guy got discharged to a medical hospital, found out he had a tumor in his freaking brain. So that's what I do, is just hopefully you monitor it and you just do the best you can. Tell us your experience with a very ill patient who required a lot of time. How did you manage this patient's care while ensuring other patients were adequately cared for? I mean, the reality is some patients are going to require more time than others. And I think you just, as a clinician, you have to keep it in the back of your head. How much time am I spending with this patient? And is the time that I'm spending with this patient therapeutic? And you kind of have to take this egalitarian view, like, is everybody getting their fair share based upon what they need? If the answer is no, then you just need to adjust the amount of time you're spending with every patient. And I always try to spend a little bit of time with some patients, but some patients, the reality is you just have a difficult time establishing rapport with them. And so you may not spend as much time with that patient, or you guys your personalities may not jive as well as you and another patient's personalities jive. So if that's the case, you hopefully as a team, there's somebody in the team that has good rapport with them, and you just make sure that as a team, you guys are kind of giving buddy the TLC that they need. All right, you guys, I feel, at this point, I feel pretty utterly exhausted by answering these questions and somewhat unmotivated. So I'm going to call it a day. Hope you found this video helpful, and I will see you on our next video.